Manon Bolliger, and I'm today with Dr. Connie Pugliese, who's been in practice for, oh my God, how long, Connie?
Since 2002.
2002, okay.
So a long time.
Yeah, and we're going to talk about practice generally and what makes a practice work and the challenges and then how to overcome some of them. So maybe, Connie, you can just say a little bit about yourself and we'll go from there.
Definitely. Yes, so I've been in practice for 15 years. I started using Bowen Therapy, Bowen technique, in my fourth year of naturopathic college. And I needed a tool to help people with pain. I wanted to focus on pain. I needed that tool, and acupuncture. A lot of people are afraid of acupuncture. So when I was introduced to Bowen, it was so simple, so gentle, and as I was told, so effective. And we did see it in our practicums, the effectiveness of it. So it just attracted me. It was affordable. And it just made sense. It fit into a naturopathic practice very easily. So I started that before I even graduated, which was nice because I got some patient care experience, case management, that kind of stuff. So it was helpful for me just in patient management, and it was effective, and so it gave me referrals instantly. Even though it was difficult for people to find me because Bowen was and is still pretty unknown, people did find you through referrals. And it still is the case. I would say 90% of the patients that come for Bowen are from referrals. So, in total, I think I've been about 80% effectiveness. And those 80% of people will just keep talking about you. And I get it all the time. I told this person about you. I told that person about you. And I'd say it takes them a while. Most of them, it takes them a while to come, but they end up coming. And it often amazes me. Sometimes the successes amaze me. I don't know who it's going to work on. I don't know who it's not going to work on. However, I do what I have to do. I follow protocols. I follow what the patient's telling me. And usually within 1 to 2 treatments, they're seeing a significant change. Mm-hmm. So the person who doesn't see a change, and I tell this to them as well, I don't think it was Bowen that didn't work. I think that I didn't find the right move for that particular person, because as we know, it's not where they feel the pain all the time. Mm-hmm. So if I just wasn't investigative enough, if I just didn't ask the right questions or look for the root cause, maybe I wasn't getting the results that I needed. Mm-hmm. I'm impatient. I like them to have results within 2 to 3 treatments, maybe not complete resolution, mm-hmm. but I want them to have good results. And if they don't, I start to get antsy about 2 and 3 visits. So again, some of those non-successes could be my impatience and my just lack of ability to find out where the root of the problem is. So that's kind of a bunch of things in a nutshell, but yeah.
That's a lot of pieces. Yeah. You use the word impatience, right? That's what you said. And it's funny because that's how my patients see me too. I mean, loving, caring, but as far as results, I'm impatient. I need to see them. And it's interesting that you use that word, because also that creates a kind of a connection, because they know that you're not playing around. You're expecting something.
Exactly.
And that also makes them, more confident that you're looking out for this and you're not wasting any time here, right? So that's a very interesting insight, which I wasn't, consciously aware of doing until you said it,
Yeah.
Yeah, no, interesting. So yeah, one of the biggest issues that has come up in my survey, there's several, but one of them has been that is how do you get patients coming to the door? And so you're saying pretty well, it's referrals.
Yes. Yeah. I have done 0 advertising. Maybe I did some in the beginning, which gave me absolutely nothing. I've done plenty of talks. I've done lots of that stuff, but the 90% for sure is definitely referral based.
Mhm.
There are people that, you know, are seeking out Bowen because they've heard of something, and then that person is not in their area, so they will find me that way. But it's always from another person who's had success with Bowen. And there's a few reasons for that, I think. First of all, as I said, Bowen is unknown still.
Yeah.
Still considered out of the box.
Mhm.
People are really inundated with, especially now with stem cell therapies,
Mm.
PRP therapies,
Yeah.
lots of deep tissue painful therapies, basically. And that is really coming out right now. A lot of that is coming out. And so Bowen is totally the opposite spectrum of that. So it's really hard for people to believe in it. And I had a patient tell me once the reason she thinks, you know, I'm maybe more successful than other people. But she told me that the way I prepare the patient before the treatment, I think makes a big difference. To put that expectation of minimalist and relaxation into the therapy, you know, really telling them, I'm not going to talk to you during the treatment.
Right.
If you fall asleep, that's great. Really educating them on what the actual therapy is and why it works. Because we have so many of those type A personalities that are sitting there, eyes open,
Yeah.
you know, and maybe it'll work, but I think that the person who really understands that they need to be in that parasympathetic mode will do better.
Yeah.
You know, and they'll respect themselves between visits as well. You know, you
Yes.
have those patients who are seeing 5 other therapists, which is great, and I love those other therapists because I do all those therapies on myself as well. So I tell them that's wonderful. Can you just wait? You know, if they can't wait a full week or anything like that, I'll tell them, can you please wait a few days? Don't do it right after Bowen. I just tell them they're wasting their money because they're doing 2 therapies that are trying to do the same thing, and which one's working. So that becomes a challenge for those types of people who just, you know, can't accept the essence of what Bowen is, really.
Yeah. How simple it is. You know, I think, yeah, that's definitely part of it is educating them on, you know, how it works and what's needed for it to work, right? And what do you actually tell people? Because that's the other thing that came up, is like they don't know what to say about Bowen and how it works. And, you know, we're not looking for the deep, well, I mean, sometimes you have to give a more medicalized explanation, but give me, if you can, off the top.
I can totally do it. I say it all the time.
The easy version and the more.
It's a patient version, so it's pretty easy. So I'll say first, it was created by a man named Tom Bowen from Australia. He was a trained osteopath and developed this protocol on his own. And the way it works is it puts the body into a very deep relaxation mode. So that is where all healing occurs. So while you're sleeping, digesting, that's when healing happens. So our goal is to get your body into that deep relaxation mode as quickly as we can. It also works on trigger points. So we're releasing trigger points, and that could be also why we get that achy feeling after Bowen. So we're releasing those trigger points. We are affecting the fascia, which is what surrounds our muscles like saran wrap. And if there's a kink in the fascia anywhere, it can affect a different body part. It's balancing. So the muscles that are not active or kind of asleep, they are being awoken and ready to work, and they're relaxing the ones that are overactive. So it's a very balancing treatment. And that's also could be why some people get that muscle soreness, because it's almost as if you've had a workout, and that's one of the most common comments after a treatment. The next day they feel muscle soreness as if they've had a workout. So I think that's basically what I tell people. And that goes over pretty well.
Mm-hmm. And when the people say, well, you know, but how could you barely touch me and you left the room and you, what do you say to that? 'Cause that's the next.
I can't, I don't even try giving them an explanation because, and I usually say to them actually before, another thing I also say is you're going to be lying there thinking she's not doing anything. You're going to be skeptical the whole time. You're going to be like, whatever. As soon as you get up, you're going to feel the difference. It's not like a massage. You're going to feel different when you stand up. And sure enough, when they get up, they tell me that exact same thing. They're like, I can't believe it. You did nothing. And yet, you know, I feel so much better already. And I also find in my practice, they get the most benefit overnight after they've woken up. They get some, you know, some relief that day, but then the most change happens the next day. And I just tell them your body needs a nice sleep. And that's why you're going to feel tired later. Get a nice sleep, and that way the body can really incorporate all the messages, all the information that the body needs to process will happen overnight, and in the morning you'll feel the biggest difference. But as to why the gentleness works, I just tell them that we're not forcing the body to do anything. We're not pushing bones, we're not changing where your muscles are, because that's not permanent. Your body will likely go back to the way it was. So Bowen is just kind of telling the body to reboot, reset, go back to its original alignment. And so it will do that on its own, and that's why it takes a little bit of time for it to work.
So Connie, the other issue that came up, and I can just see like you answered so clearly. I mean, you're educating and you're super confident. So were you always confident, or how did that?
I'm pretty good at faking confidence in the beginning. I think that if, you know, I was excited about it. So when you're excited about something, it makes you look more confident. But yeah, I really do. In most of life, you got to fake it before you make it. You just have to exude that, because that, you know, in any therapy, doesn't matter what it is, 30% of your success is placebo anyways. So if you can just have confidence, and it will be 30% effective in your patients. So that's huge.
It is huge. And I think I like the way you said it's the excitement, because in excitement is confidence, right? It's like, it's the, you know, they want to play with you, they want to try this with you, and that also sets a very healing expectation and tone, you know. So okay, good. Now, has there been any, like, what you would say a major challenge to your practice? Probably at the beginning more than, although you're about to have a fourth child. Challenges, like, and you know, has there been anything that stands out for you?
Well, it definitely, I've been blessed to be able to have a home office for the most part. So my expenses are not overly huge. So I don't need a massive client list. Now, so that would probably be the biggest challenge, is to get a lot of clients. So it goes in waves. I get these months where there's a million new patients calling, and then I get months that it's really low. But in my life, that's okay. I can handle that because I have so many other things around me, my kids and everything else. So it's okay for me. So I don't panic in that sense because of that. But I would say that is the biggest challenge, is getting clients, and how do you get them? As a Bowen therapist, I think if you didn't have a naturopathic license or any other professional sort of designation, you have a little bit of an advantage with advertising. You can do a little bit more creative advertising, whereas when you have a naturopathic license, we are so restricted in what we can say and all that kind of stuff. What in an ad, in person, it doesn't matter. It becomes very difficult for us. So I think that I would have had to be more creative and more aggressive with the way I got clients, had I been in a different situation. But I was just lucky that I don't have extremely busy.
Yeah, and it's interesting because, you know, the Bowen therapists that are not licensed professionals in another therapy feel like we have a big advantage. And it's interesting because, you know, we don't really, because we can't advertise. We can't even put testimonials up, you know.
Exactly.
Which is very challenging. And that's what I'm looking at, you know, creating a place where all those can live without it being a risk, you know, to our professions, right?
Yep.
And then credibility, that's the other piece, is the, you know, because there's the Canadian Examining Board, you know, which exists. And, you know, I'm following that up again now that I'm available to do so. But, you know, wondering what's the difference if there was, there's an accreditation, but if we were really making a point of that. But I guess for you, it's hard to comment on that since you have a different license, but you have experienced the opposite, and it's easier to have, if, yeah. Yeah. So
yeah, but I do see people are happy that I am an ND for sure. That's not usually the reason they're calling.
no.
It's like a bonus for them. But otherwise they found me just because I was a Bowen therapist, not because I was a naturopath.
Yeah.
So, you know, I don't think it really influenced their decision in that sense. It just helped them a little bit. Insurance wise, they were covered, which was great for them. But otherwise they didn't care at the beginning.
Mm-hmm. And do you find, yeah, no, it's the same with me. It was known as, you know, a homeopath or a Bowen therapist, like the naturopath came sort of third. But as far as coverage, how percentage wise of your patients, how many actually have coverage? And I'm thinking more for Bowen, obviously.
Yeah, I would say it's about 60% of the people have coverage. And that's just based on the general average of people who have coverage. But it's never been a limiting factor for somebody to come. You know, when you want pain relief and or any relief, it's they'll pay for it. And it's not that expensive because of our impatience. We get them better pretty quickly. I don't want to be seeing them every week. So, you know, for ongoing, I just want to see them, you know, 3 or 4 times and then come back in 6 months or a year, whatever they need. They know when they need to come back.
Yeah.
So, you know, I'm very happy to see them at those moments.
Okay, great. Let me see what else has come up here. Oh, well, actually, the other issue is charging. And so, you know, that's one of the issues that people have is, you know, how can you charge when you do so little? And so could you answer that?
Well, time as well. It's not just what you're doing physically on them. It's the time that you're spending with them. You know, I started out that way for sure. I always had an issue with charging people anything. And then and now, you know, I just look at I compare it to other therapists as well. So I see a craniosacral therapist, because I work in the home again, I can be a little bit less expensive, but you know, they're charging $130, $140 for an hour for craniosacral. And I would say craniosacral therapists do less than we do. So in terms of physical touching people. So I'm charging $120 for the initial and 80 for subsequent, which I think is low, but you know, my patients are really long time patients. So I'm not increasing it at this point, but I think that's pretty low. But I don't feel bad at all. I think it's very much at par with what you do, what other practitioners do. You know, massage therapists ranges about $70 on a low end, $70 an hour for a massage therapist. And, you know, it's not permanent. So, you know, that's how you got to see it. They're not going to see me as much as they see a massage therapist.
Right. I mean, and the key is to look at it on the results basis, right?
Exactly.
Not money, not time, actual results, right? And because that's what people actually want, you know. You know, and so if you look at, you know, what is it costing you to be in pain for so long? You know, if you kind of flip the equation, it's really easy to charge. And me too. I used to trade for time, you know, chicken and egg. Okay. I think we all have our story. Okay, let me see. What else came up for people? Give me just a moment. I took notes. No, I think we've covered coverage. We've covered confidence. Well, okay, just out of, because you're still in a community that you talk to other Bowen practitioners. What do you see, or what do you think would be the most useful, from what you've heard of others or just your own observations, that would really help, Bowen practitioners get out there and be better known?
I know when I started, I did the networking groups. I found that helped me. Even if you're just gaining a community, you may not get a lot of patients at the beginning. It takes a while to make bonds with people. So the networking groups, I did them for quite a few years, and you get a lot of connections. And if you really stick with it and you know how to network, you can get referrals. And as soon as that happens, you get one success, it's just going to snowball from there. That's you have to bank on that one patient who talks a lot, and is able to bring you referrals. Other things, there's something I wanted to mention. So sometimes if either I've gone away or a patient was desperate and they had to see someone else, they'll come back usually, and I often get, they weren't the same, they weren't like you. Now when I hear that, I'm always asking why,
Yes.
What happened? Why was it different? And usually they say that they weren't doing Bowen. So I really do think that people, and I'm guilty of it too. Sometimes I'll do acupuncture with it just because I feel like it's a local pain. I just want to get rid of this pain. I'm going to do acupuncture with it. But I really do, people think that they can sort of change the technique too much in a way.
Yeah.
Either for whatever reason. And I think that it doesn't work. And so they don't get success. And so all these people are coming back saying it wasn't the same, I didn't get the same results. I don't know why. And it's usually that they have not kept true to what Bowen is. And I also think that practitioners, if you're not doing it frequently, you lose your proficiency. So whether you have to go and take a refresher course, but you just have to keep using it. The longer you go without using it, your technique dwindles, or whatever it is, you're just not doing something right, and so you're not going to get the success. So I find that's the biggest issue, I think, with practitioners who are maybe not trusting it, or whatever reason they're not doing the actual technique. So I would keep true to it.
Yeah, no, that's a very good point, because I know when I teach as well, that's why I say just try it, see what it's like for itself before you attempt at all to mix it. And as far as adding acupuncture or other things, it can accelerate sometimes or augment, or it's not that it's a big rule you should never do anything else. It's that get super confident, see the results, and then judiciously add if you want to, or if you can, or whatever. But it's not necessary, and that's the thing. I think most people don't have the actual confidence in seeing the real results that you really get just doing Bowen. So that's a very good point, and that gives a mixed message in in the neighborhood or in the community, because it's like, well, that wasn't really Bowen. And I've gotten that too. So it's like, how do we get, and that's one of the things I think I need to really focus on, is the people who are registered actually do what we do, like that actually gets results with this, because that's really important, as we get the word out and reach more people who desperately need this work, so.
Definitely.
Okay, so is there anything? And then otherwise, thank you so much for your time here.
I don't think So I think I've said everything. I'm good at talking. So I think I've said everything, it's it at times it's 100% of my naturopathic practice, right? It's
Yeah.
so effective. People are so grateful and they're just so much happier. So, it's, I have to add sometimes nutrition and naturopathic things, which is fine. But it's, yeah, they're just super happy. So it's a great therapy. It's worked for many of my clients, and, and it makes me happy to do it. So.
Okay. All right. Well, thank you again for your time, and best of luck with the birth and the birthing process and the baby. All right. Okay. Thanks, Connie.
No problem.
Bye.
Bye.